Welcome to the Wellness on Tap podcast with your host, Dr. Debs Eastwood.
Clear my throat and let the world know that sitting opposite me is Kaidi, who has travelled a long way to be here with me today. So I am super, super, super grateful. And I have been dying ever since this gorgeous lady lent us a property to do a photo shoot in. And we were just saying that's probably about a year ago, isn't it? And I was just enchanted then by what she does because I come from a science element and it has that, but it also has all the wonderful beauty of nature in there. So, where do we start? Anna, tell us what it is that you do that sort of drew me in, do you think?
Well, I think I'm a matchmaker between plants, medicinal plants, and people, and but all herbalists are. And as you say, herbs, is the original medicine, and there is a lot of science behind it now as well, and more comes out, obviously. But there's also has this quite almost like a magical element as well, because there are some things that we just can't explain, and when we're in nature, it just draws you in, doesn't it? And all the smells and sounds, and we talked about wild garlic earlier.
Yes, beautiful smell.
It's the same with herbs and food, and because all culinary herbs are also medicinal. So yeah, I think. Might be also because I get really, really excited when I talk about herbs.
Yay, good.
And I think people just thought like, oh, what was she on about? And it was like, oh, about rosemary. Let me tell you about rosemary. And sometimes people are like, who's rosemary? It's like, no. Rosemary from your garden.
Wonderful.
Yeah.
Have you got a favourite herb?
Well, it's like asking, have you got a favourite child?
Difficult to say.
Yeah.
Yes.
But I do like rosemary a lot. It's a fantastic herb. It's a culinary herb. It's also fantastic medicinally. But I think we go through phases that where we like some herbs more than others, and or when they sort of come to our consciousness more than others. And that can be because something we need or something that our patients need, or just generally, I don't know, they just suddenly appear and it's like, there you go, let's work together.
Yes, the universe giving you the answer.
Yeah.
I love it.
Yeah.
Sorry for that tough question.
No, but there are so many that when I walk around, so when you go for a walk with a herbalist, if the walk normally would be, let's say, an hour the distance, with a herbalist, it's guaranteed it's going to be 2 hours because you'll be stopping and like, oh, look at this plant, and this is the history and the magic and the medicinal properties and virtues. And then we walk a little bit and it's like, oh, but look at this. And some people are like, but they're just weeds. And we're like, well, no, they are colleagues, and they come, and when you take them internally or topically, they have their own medicinal virtues, and obviously in science we would say medicinal properties, but I quite like the old-fashioned word virtues, because it's sort of, because sometimes lots of herbs have been scientifically studied and lots haven't yet, so there's a lot of tradition, but sometimes the medicinal properties or virtues, they suddenly appear, even if we know traditionally certain actions of the herbs, but we're all different as well, and sometimes herbs work in a quite magical way, and I know it's not very scientific, but sometimes it doesn't have to be, I think.
No, absolutely not. It doesn't have to be at all, does it?
Yeah.
It's just when I remember you showing me some of the data that you'd had coming out of a specific part of the work that you do. That was where I thought, oh yeah, as a scientist, my brain automatically went, data. But this part of my body now, that's my mind, this journey that I'm on, I'm far more interested in soaking up all the other stuff, the stuff that comes from nature and from tradition and from our history and civilization.
Yeah. Well, we can mix and match science and things that we don't yet know how to explain scientifically. Because, when we think about, let's say, 20 years ago, maybe even 10 years ago, when scientific community was like, yoga and mindfulness, whatever, blah, blah, blah. And now, actually, there's so many studies that, these 5,000-year-old traditions and practices, actually, they're pretty good for us.
Yes. Who knew?
Yeah.
Yeah, it's like it's been shoved under the carpet, isn't it? For quite a long time.
But then, obviously, we have to be safe as well, because there are many plants that are pretty poisonous. It's the same with paracetamol. If you take too much, it's very toxic. And it's the same with herbs, that some herbs, they have a quite narrow therapeutic window. So we really have to know the dosage. And that's why you need somebody who's properly trained. Because in the UK, this herbalists, they're not... there's no laws really, and anyone can be a herbalist. So you can do a one-day course and call yourself a herbalist.
Oh, that's a bit scary.
Yes, exactly.
Okay.
And, when you start working with somebody, always check their qualifications. Yes. And, there's a big difference. I did my undergraduate course, obviously, graduated, and then a year later I was invited back to the university to teach. And there's somebody who's done, a weekend course and is a herbalist. So
there's a world of difference there, isn't there? So, I mean...
Yeah, because it's not regulated.
And this was part of my problem when years ago my brother was sick and I was looking for people and I'm like, well, how do I know, first of all, what modality is going to help him? Yeah. And is this person suitably qualified to be advising me?
Yeah.
And I had a time window on me there and an anxiety window and a grief window that, everything was against my being able to properly research what was going on.
Yeah.
But the fact that somebody has actually put in the time and the effort to go to university and get a degree out of it, had I have seen that, coming from that sort of background myself, I would have thought, okay, then, she's likely to know what she's talking about and I can recognise that. Do you think that's helped you?
Yes, because I have a very quite academic brain. So I want to know things, but I'm open to other things as well. So, as I said earlier, that the herbs, there's definitely, with phytochemistry, you can't, this is pure science, and it's so complex. And we have biochemistry, so we need to think about the pharmacokinetics and pharmacodynamics and all that. So it's regardless whether the substance you take is chemical from the lab or chemical from a plant. So understanding all that and biochemistry and anatomy, physiology, all that side, definitely. And also, you can't graduate before you've actually had at least 500 clinical hours.
Ah, so that's a big part of your course then.
Yeah. Oh, yes.
Yes.
So you work with patients and then you dispense and diagnose. And actually, in the UK, we're quite unique position because as herbalists, medical herbalists, we are allowed to diagnose, whilst nutritionists are not. But there's so many people wouldn't have a clue what a herbalist is. They're like, is that homeopathy? No. So I need to explain that,
How would you define it then? What is a herbalist?
Well, as I said, there's different forms of herbalism. And, you can be a home herbalist, as kitchen herbalist, that's all fine. But if you want to work clinically, in my mind, you do need clinical training. You do need the scientific training. And it's basically... So we can't call ourselves doctors, obviously, because, going through medical school is very different to doing a degree in herbal medicine. But in terms of the training, we still get the anatomy, physiology, pathophysiology, biochemistry, clinical training together with herbs. So we see patients. I'm not sure I really like the word holistic.
Okay.
But for the lack of better word, we see patients as whole beings.
Yes.
So the first consultation is usually, well, it depends on a herbalist, but an hour and a half. And sometimes I've even had 2-hour consultations because we go through everything. So medical herbalists, we're healthcare professionals.
Yes.
And we see the whole person, not just their ailment. We want to go, down to even to their childhood diseases, their family history, any traumas that have happened, any, everything really.
Yeah, because that all contributes to where we are now, doesn't it? Physiologically and spiritually.
Yeah, absolutely. Absolutely. And even things like if people are been on antibiotics for a long time. And, sometimes I see patients and they're like, oh, I don't know, I've got all these gut symptoms and we're like, so have you been on antibiotics? No, just a couple of times. And like, have you had anything, something happened, and have you been on strong antibiotics? And it's like, oh yeah, there was this one time. I was like, okay.
Yes.
So it's sort of like health detectives, but, obviously, because you do spend that time with the patient and you build a rapport and you tease out the information and also, some patients, especially when they've had a chronic disease for years and years and years, they're so used to living in their bodies with that disease or that ailment or whatever, they're suffering with. They've forgotten what it's like to feel great.
Yes. That is their new normal. It's not a term that I like, but it has become that, hasn't it?
Exactly. And I think a really big part of being a medical herbalist or a herbalist is giving people the time to talk. This is a really big part of the therapeutic relationship. Just hearing them out.
I completely agree with that, because within the NHS, the health professionals there don't get the time, do they?
No. GP appointments are 10 minutes.
Yeah.
So, and lots of people have, not that GPs wear white coats anymore, but this sort of white coat syndrome that sort of they're a bit scared anyway, and they don't want to open up, and even if they have a plan, often it's like
it all goes out the window.
Exactly.
Yeah, I get that a lot with my patients.
Yeah.
As an anaesthetist, I mean, they're going through something that is very significant to them, and each patient is significant to me, but obviously in a completely different way. But yeah, it's a significant thing. It's potentially a really scary thing, no matter who they're seeing. So somebody like you who can sit down and actually, over time, people ease, don't they?
Yeah. And also, I found that sometimes herbs can be they work sometimes in such a sneaky way.
Oh, I like sneaky.
Because sometimes some of the remedies, they can be so gentle in terms of their actual chemical composition. So, for example, we had a patient at university clinic where I was teaching, and so the patient was struggling with fertility, mainly because of the endometriosis. And, it's a really horrible disease. It's really painful, and, it's emotionally really draining. And, first couple of consultations, she was pretty much just crying there. And it's fine, it's a safe space. Just cry, it's fine.
Absolutely. But to be at that level that you're that fed up with it.
Yeah.
Bless her.
And so we gave her different herbs, and I was supervising the students there. And I said, how would you feel about if I give you a rose spray? So it's aromatic water, so it's a byproduct of a essential oil making. And she was like, well, I don't know, okay. Didn't really think much of it. And I said, explain that. It can be really quite powerful. It's very gentle. It smells gorgeous. And she's like, okay. And each time she came back, it's like, can I have more rose water? Because she said that it's the only thing where she just feels the sort of like, she could almost feel the herbal cuddle, the sort of comfort. And it's just a rose spray. You know, it's just, it's so wonderful. And
a herbal cuddle.
I know.
I like that. That's a gorgeous phrase.
Yeah. And when you think about rose as well, not chemically, but sort of as a plant, they're so beautiful, aren't they?
Yeah.
Yeah, they're really gorgeous.
Yes.
Some of them smell absolutely beautiful, but you really respect them because they've got thorns. So in terms of creating boundaries, I find it gives you really lovely emotional support, but I've seen it also in practice that it really helps, especially women, creating really healthy boundaries. Because it's like, right, I'm like a rose. You know, I can be really beautiful, I can be really lovely and soft, but careful, I've got thorns.
That is one of the best explanations of a rose I think I've ever heard. Wow.
Well, I just sometimes, well, not sometimes, every day I think about herbs and plants and sort of, my head is quite a busy place. But yeah, just thinking about, you know, what their herbs are like, because they all have their own characters as well.
Yeah.
So as we have, they have as well.
Wow. I thought about a stinging nettle then. I was trying to think of the virtues of a stinging nettle, because that obviously has a bite, like a rose thorn would have.
Well, stinging nettles are amazing medicine because all parts of it are medicinal. So in medicine, we work with the seeds. That can be quite beneficial in supporting the kidneys. So there's a little caveat. Herbalists were not allowed to treat kidney disease. It's illegal.
Oh.
But we can support people with certain kidney ailments. And yeah, so the nettle seed is also very nutritious, but it also works really well. People who've got low kidney function, it can help to boost that. But again, it depends on the person and, you know, person case by case.
Yeah.
And nettle leaves are fantastic. They're so nutritious, full of vitamins and minerals and high in iron. It's also tasty as food. You can make it into a nettle soup. Very delicious.
Makes nice wine as well.
Okay. And it's fantastic for hay fever, although in itself it's quite high in histamine, but it's a brilliant antihistamine together with some other herbs as well.
Oh, wow.
And nettle root, in practice we use for prostate issues, so enlarged prostate, and also together with some other herbs as well, even with prostate cancer as a adjuvant therapy.
Yeah.
And in the olden days, and I think even now, nettles, fresh nettles, people used to beat their knees or joints with nettles, so the sting gets the blood flow to the area.
Yeah.
And apparently it's really good for arthritis as well.
Wow. That's mind-blowing.
I know.
I never thought when I said nettle that there would be so much wonder attached to it. That's really quite incredible.
I know, amazing, isn't it? And
Yeah.
it's really high in silica as well, so great for hair and nails. And fantastic.
Who would have known? Who would have known? I don't think everybody would be interested in beating their joints with a nettle, though, would they?
Probably not.
They'd want you to find a gentler route, I would imagine. But
Yeah.
nonetheless, I mean, if you're really struggling...
Yeah. Yeah. But internally as well, if somebody has arthritis, I would prescribe nettle as a tea. It's
Wonderful.
fantastic. It's really good.
So
And
how
common
did
herbs.
this fabulous fascination that I could just wander off down a serendipitous rabbit hole here for ages, exploring different plants, but how did it first come to you that was what you wanted to do? Because that's certainly not where you started, is it?
No. Well, yes and no, actually, because as a child, I grew up in Estonia and my grandparents had a small holding. So it was all summers we spent outside in nature. And even as a very small child, I remember foraging herbs and berries and mushrooms, because you live in the same rhythm as nature. You know, as the seasons, you learn from a very young age to notice the environment around you, and you would see that, you know, if the birds were flying really low, it's probably going to rain. There's no clouds yet, and 2 hours later there's rain. And you just get to know nature. And as I said, I was just always collecting herbs and for the winter. And I don't know, I guess my grandmother must have taught me what herbs are for what, or I don't really know. So herbs have always been in my life, and foraging, mushrooms, and berries. It's a big part in Estonia anyway that people forage.
Is it? Is it part of the culture?
It very much is, yeah. Estonians are quite nature-loving people. There's a lot of forest in Estonia as well, and you know, there's the population is only 1.3 million people in the whole country.
Oh wow!
Yeah, so
there's a lot of nature to go around.
Exactly.
How lovely.
But then I went to uni. I studied history of Estonian culture, and I wrote my dissertation about natural healers and, you know, nature, because it is part of the culture. Mm-hmm. But then I actually ended up working in a television industry, film and television production, for quite a few years, and then moved to London and again worked at ITV and Channel 4. And it's funny how sometimes, you know, life just throws you into different places.
Yes, we have to learn something from everywhere we go, don't we?
And I remember even when I worked in telly that, you know, people were like, oh, I've got this and this. I was like, oh, but have you tried nettle, or have you tried mint, or have you... would always just, you know, probably quite annoying, but...
Not if it works, surely.
Yeah. And then it was the 2008 recession, I think 2008-9, and TV work is mainly freelance, and suddenly I was out of job.
Right.
And I thought, okay, what am I going to do now? And so I was looking for some temping jobs, and because speaking a couple of few languages, I ended up working for the European Medicines Agency as a temp, just admin. And then I realised that actually, I met some lovely people then. Actually, I don't mind. I quite like it. And then in the end, I worked there for 10 years. And my job changed quite a lot over those 10 years. And the last, 6 years or so, my job was to allocate, so we would get a pharma application, and people who don't know what the European Medicines Agency is, basically a pharma regulator for the EU. And we would get an application, and I would check what the drug is about and allocate it to the scientific staff based on their expertise. And as I was reading some of the applications and thinking about those diseases, and thinking like, but these ones are sort of lifestyle diseases, and these can really be nudged with herbs and nutrition. And then I just had I was like, right, okay, I need to get back to uni and retrain.
So that was the nudge.
Yeah.
In your very long temp job.
Exactly, yeah. Yeah. Well, actually, the first nudge came a couple of years before that, when my friend and I, we went to trek the Inca Trail in Peru.
Oh, wonderful.
And we were in Cusco. I think it was before the trek. It probably was. And we were in an Irish bar. There's Irish bars everywhere on there.
That's not what I expected you to say.
I know. And it was before the trek, and you're in an Irish bar, have a few drinks, and as always, you just get to chat to people. And there was this Scottish psychiatrist, and he was researching ayahuasca in Peru. We got chatting to him, and he was like, so girls, what do you do? And we're like, oh, we work for the European Medicines Agency. And then he's like, but what do you like to do? And my friend said, oh, I love gardening and I love dogs and da, da, da. And then I said, oh, I don't know, I really like herbs and I really like nature. And then he said, if you'd see how your body changed when you talked about herbs and your job, girl, you need to think about it.
Yeah.
And that was like, okay, yeah, probably. And that was when the seeds sort of like was sown, and then a couple of years later, that proper epiphany at work was like, oh, come on, we can do something about, like, pharma can be great. We need acute medicine, absolutely. But lifestyle medicine and lifestyle diseases, there's a lot we can do just with nutrition.
Yeah,
and
that
herbs,
doesn't need big pharma.
And also, the polypharmacy that is happening at the moment, especially with the older population, no one checks if those drugs interact with each other. And in the end, patients are on 10 different drugs. So when we take it back and see that, right, okay, they may only need 2 of those drugs, and the rest of the stuff, or even the side effects from those drugs, we can tackle with herbal medicine and nutrition. But obviously people don't know what's available to them, and NHS is free, but all these practices patients have to pay, and that's not affordable to everyone. Yeah. That's why the university clinic was so good for patients, because it's very low cost. And
that does make a difference to a lot of people, unfortunately, doesn't it?
Yes, absolutely.
I mean, what's interesting, though, is obviously the NHS might be free face-to-face, but we all pay for it, don't we?
Excuse me. Yeah, absolutely.
Indirectly or directly out of our wages, but we don't see it as, it doesn't say on your pay slip if you, this is for the NHS. Otherwise, you might think a little bit differently about it.
But I think I've been pondering about it a lot. That, I mean, obviously, there's so many things we can do to help the NHS. And one of the things I think that would be great is to do blood tests. Start early, let's say in their 20s, patients in their 20s, just see the baseline, what their bloods are like. And then maybe 5 years' time, something changed, and then we can really nudge. And blood tests overall, they're not that expensive. Well, it depends on the blood test. There's some specific ones that are, but the general one, they're not really that expensive. And then you can see the trends.
Trends are massive, aren't they?
Exactly.
They're so much more informative than a one-off number.
Yeah. But also, with blood tests, I always ask my patients to bring in your blood test the last, even 5 years. Or they come to me and it's like, oh, I've got this symptom and this issue, but my doctor says that my bloods are all normal. I said, okay, let's have a look. Because sometimes the reference ranges are really big. When we look at like ferritin is from 15 to 150.
Yeah.
So what's your normal?
Exactly, yes. Yeah.
And, some of the other ones as well, that if they're sort of either end of the normal, patients will definitely have symptoms. And then we can really nudge things with nutrition and herbs. So, yeah.
I mean, I noticed that a lot with my clinical patients as well, the reference ranges. And sometimes they change them as well.
Yes.
I'm like, what's that all about?
Yeah.
Has all of a sudden the whole totality of human physiology changed? Maybe that's just my ignorance of the way things work. But, I mean, one of the more common things that I do in the theatre situation is have to assess if people need blood.
Yeah.
And yes, we do go on the number, the hemoglobin count, but I also I look at the patient.
Yeah.
And are they actually symptomatic? Because some people are very, very good at tolerating a hemoglobin level that other people would be completely symptomatic for.
Yeah.
And, if you need blood, then you should have blood, as long as that falls within your belief subset. But it's just as harmful to give it if you don't need it.
Exactly. exactly. But yeah, reference ranges have changed because I think NICE guidelines changed a few years ago for diabetes score, so the HbA1c. It used to be reference range, I think used to be 20 to 40 or 42. Now it's 48. If somebody's number there is 40 or 42, they're pre-diabetic.
Yeah.
And this is the moment where we can really, really go in with nutrition.
Yes. Completely. I mean, that is a lifestyle/nutrition disease in its purest form to me.
Yeah. And again, trends. So that patient, let's say, would have seen 5 years ago, let's say that specific blood marker was fine. And then 3 years later, it's crept up a little bit. It's like, we can really change things. And yeah, I mean, there are some genetic factors as well, because in my practice, I do something called nutrigenomics, which is a very exciting science. This is pure science. And it's come it's changing, ever changing, obviously, because that's just the nature of science.
Yes.
But it's basically, we look at something called single nucleotide polymorphisms.
Oh, yes.
Which, try to say that when you've had a couple of drinks.
I bet it comes out very wrong.
Or we call them SNPs,
Yes.
basically, much easier. And so, for example, if somebody's got SNPs on how their liver enzymes work, if you get normal blood tests done for liver function, for those to go wrong, you already have a liver disease, most likely. But if you know that you've got SNPs on your liver enzymes, or how the liver enzymes function, then again, with nutrition, we can really nudge it. So, for example, I say to my clients or patients, explain about the different phases of liver detox. And it's a very simplified way, because I don't want to go on about oxidation and all those things. So, have to explain it in a way that's quite graphic to people.
Yes.
And so I explained that the phase 1 is when the substance goes into the liver and the enzymes then create quite a lot of toxic sludge. So put that image in the head. And then the phase 2 is that toxic sludge is being neutralized. And then phase 3, we get it out of the body.
Lovely, yeah.
I mean, it's a very simplified way to explain it.
You don't know where every separate patient or client's coming from, do you, in terms of their understanding?
Exactly.
Yeah.
And also, I quite like them to have a little mental image that, oh gosh, I better look after my liver. Considering what the liver does, there's a lot of heavy lifting for the body.
Yes.
And now we do the nutrigenomic test, and we find out that there's SNPs on phase 1. So the phase 1 is too fast, and the SNPs on phase 2, they're too slow. Now, if you imagine, because those enzymes are not working whether too fast or too low. Now imagine phase 1, the liver's worked really hard. There's lots of toxic sludge. And phase 2 is really low. Now that toxic sludge is in your body for a long time. And phase 3, which is basically elimination, you get it through the bile and out of the body, through, feces and wee. And I see so many patients who are constipated. So imagine now, they've got fast phase 1, slow phase 2, and they're constipated.
So they can't get rid of it.
There's so much damage happening in the body. Yeah. And when you go to your GP and you run the liver function tests, those won't show anything yet.
No, because the liver has to be actively damaged.
Yeah.
Interesting.
So having that information is so fascinating.
And that could be some tests then that you could run alongside.
Yeah.
Standard blood tests.
Yeah. Well, it's a gene test, so it's saliva, or the buccal swab, yeah. It's just fascinating. That science is wow. I sometimes get quite geeked out, and all the CPD events as well. I'm like, oh, tell me more.
I think that was what you were showing me, because there were some heavy duty charts that as a scientist I was like, I don't appreciate exactly what's going on. This is not my speciality, but I can see that this is going to this and that, and you're doing that, and ooh, I like that.
Yeah, and when you think about hormonal health as well, so especially phase 2 detox and how the estrogen is detoxified, so this is relevant for men as well, for prostate health. And when we see that there's SNPs there, and we can really nudge it then to make sure, my partner always laughs that I say to everyone, just eat more broccoli. But it's all cruciferous vegetables, because it really helps the phase 2. But also, if someone's phase 1 is really fast, then just have a little bit of grapefruit, And that's why often grapefruit juice is contraindicated when people are on certain drugs.
Okay, that makes sense now.
Yeah.
Because it is, isn't it? A lot of the diabetic meds, you're not supposed to have grapefruit juice, are you?
Yeah. Yeah.
Interesting. So you not only did the medical herbalism degree, you've added in this extra.
Yeah. And that actually just really makes it come together. It just really makes sense. Now it's obviously ever evolving, and I have a very curious mind about lots of things, but it's just really marries so well together, because for example, vitamins and minerals, lots of us are really low in magnesium. Well, maybe not, we're not deficient, but we have insufficient levels.
So our body's having to work harder, isn't it, without those there in place.
And B vitamins, so you do B vitamin injections.
I do.
So they're so crucial for everything. And if somebody's really stressed, their body just uses up so much B vitamins that they need to be replenished. And now if you add some genetic SNPs, well, SNPs basically, I explain that to patients, it's like a little typos on your genes.
Oh, I like that.
Yeah. Because the letters, the order of letters has changed a little bit. So it's like a little typo. And if you have some SNPs there as well, and then you add the B vitamins in there, is super crucial for something called methylation. So it's, even like cancer prevention.
Yeah.
So it is just fascinating. And these tests also, you can find out things like how you metabolize vitamin D, because lots of people actually need much more vitamin D than, because their cells can't metabolize it very well. And again, most people don't know that for the vitamin D to become active, it needs to go through the liver processes and then the kidneys. And if any of those are slightly, function slightly suboptimally, then you definitely need more vitamin D.
Absolutely. And that's part of the reason that I thought I'm going to do intravenous stuff and intramuscular stuff, because people that don't have optimal gut function, which is probably the vast majority of us, let's be fair, in this world of processed foods and environmental, whatever there might be out there, the gut isn't absorbing things as optimally as it should.
Yeah.
And if you go IV and IM, which as an anaesthetist is just my bread and butter, I'm not saying I get first cannula every single time, because that would be stupid. Some people are absolutely horrendous to try and cannulate, which is when we get called in, because we do it all day, every day. But if we can get some goodies into people, yes, I hear what you're saying, that their liver and their renal system may still not make best use of it, but at least it's there.
Yeah.
And then at the same time, they're treating their gut. And making that more effective, then they can start absorbing things through the normal routes.
Yeah. Well, but also, for example, vitamin B12, if people are on PPIs, the omeprazole or whatever, they can't absorb B12.
Yeah. And nobody tells you that, do they?
Nobody tells you that. And overall, you know, when people are on different drugs, they should really take a good multivitamin as well. And I know in the media they say expensive but it really isn't. No. If somebody needs more vitamins, but obviously it has to be the right form as well. So for B vitamins, if you take them orally, even as a spray, it's best to take them methylated. Not always, but most of the time, because it means that your body can actually absorb as well, because you know, if there's
I'll give methylcobalamin, vitamin B, exactly, because it's the better formulation.
Exactly. So your body knows what to do with it. And so often I see, pregnant women take folic acid. I'm like, well, don't.
What's your rationale behind that then? Because that is so common. It's almost,
I know,
you get pregnant and you take it.
Take folate, not folic acid. Because folic acid, the body really, well, again, it comes with caveats, but most people can absorb folate much better, methylfolate, because folic acid is a synthetic form. The body will need to work really hard to convert it into absorbable form. And if there's a snip, if there's a typo on your genes as well, it's almost impossible. And then it can really mask B12 deficiencies and other deficiencies. So, I mean, but obviously food first. But if that's not possible, I am a quite big fan of good vitamins, good multivitamins, just to get the levels up. Yeah. And, you know, the famous high street brand that does penny sales, please, people, don't buy it. Please don't buy that, because it's just really quite poor quality. And some of their herbal products as well are really poor quality. Some colleagues at uni, they did some research checking how much of the herb is actually in there, and some of it is like just hardly anything or just really poor quality. And you know, you see you'll see that the herbs I brought you, when you open it up and smell it, it's like, wow, even they dried, they smell so gorgeous. They look vibrant, they've got colour, they're like, wow. And I think that's the problem in the supplement and herbal industry, that a lot of it's really bad quality. Yes. And, you know, we have this weird paradox in herbal medicine that people say that, it doesn't work, or it's really dangerous. And it can be both, it can be neither. So it's all about quality and the right dose and even the right plant part. Sometimes some products have got completely wrong part of the plant.
Wow, that's really quite, that's where the danger comes in as well, isn't it?
Oh, yeah, exactly.
Because if you think you're getting nettle seed and what you actually need is nettle root, for instance, I mean, I don't know what I'm talking about. That's just an example that you highlighted earlier, that different parts are used for different things. Yeah. I mean, that's not going to be giving you what you thought you were getting, is it?
No. And also if you take it wrong dose, you know, it's the same. That if you take paracetamol and you take it too much, it's toxic. And it's not good for you.
No.
And overall, I mean, it's not very good for you anyway, but sometimes you need it. So it's the same with herbs. It just has to be the right plant part. It needs to be good quality. And that's why, as herbal practitioners, some of us forage our own herbs, and I do for my own use, but for patients, I have my trusted suppliers, and I see, you know, the herbs that they're good quality. Yeah. And you can smell it, that they're good quality.
That must be lovely to have a nose that's attuned to the different scents of the different herbs as well. I mean, some of them, wild garlic comes back again, are very obvious, aren't they? Yeah. You know, and mint. But again, there's so many different types of mint, isn't there?
Yeah. Well, funny you say that. In lockdown, my partner and I, we did an online gin tasting, because I like gin.
And why not?
But it's, spiritual anyway. And so many botanicals in there that is basically medicine. We did this gin tasting where at first you would taste it neat. And I don't know how many people were on Zoom. There were loads of people. And we didn't know what was in it because it was blind tasting. It smells like elderflower, or tastes like elderflower. I was like, yeah. And then there was one, it's like, to me it's like sea buckthorn. And the person who ran that tasting was like, how did you know?
Yeah.
So, but when you work with herbs, you know what they taste like, you know what they smell like, and actually with the students as well at the university clinic, whenever we had patient cancellations or we had some time, I said that, right, we do some herbal tasting now, because it's really important for them to know.
Yeah.
For example, if you're going to prescribe some teas and the herb is really, really bitter, the patient compliance is it's not going to happen. And I was always sometimes a little bit sneaky as well, with the students like, right, okay, so we do something called organoleptic tea tasting. So I draw a little face and, it's like, what does it smell like, what it looks like, what does it smell like, and then what it tastes like. And there was one particular herb, and as a tea, it's quite soapy, so it means that it's got saponins in there. Quite horrible tasting.
Okay.
I wouldn't really prescribe it as a tea, because, patients wouldn't take it.
No.
And they're like, this is really horrible. But, they got some of the plant chemistry right because of the, it's foamy, so we know there's saponins in there. And then I asked, like, okay, so if the plant has got saponins in there, what are the contraindications? And they were like, reflux, and, so it's teaching, but sort of getting all the senses involved as well. And then they're like, this is really horrible, it really tastes horrible. And then I'm like, okay, do you have any idea what plant it is? And they're like, no. And then I gave them all a piece of chocolate. And then they knew what plant it was.
Why?
Because that particular plant, when you take it, it stops you tasting anything sweet for hours.
Oh.
And therapeutically, it's a fantastic herb to use people who've got diabetes. And this plant is called, in India, it's called sugar destroyer.
Love it.
But the actual name is gymnema. And it can be really quite an amazing herb for people who really struggle with sugar addiction. Because sugar is really addictive. Mm. And when you take that, afterwards, a few hours, you can't taste anything sweet. So obviously, it's sort of like habit building as well. So if you take that herb and you're so used to having sugar, and when you eat that sugar, you can't taste it, you most likely don't want it.
Yeah.
What's the point? You don't get the joy out of it.
Yeah. So
again, working with herbs in very different way is quite a... But that particular plant is amazing for, working with cholesterol as well, and overall metabolic health, actually.
This is just amazing. I mean, some of these plants I hadn't even heard the names of before.
No,
I mean,
that particular plant comes from Asia, so it's not a native one. But I do like to try different herbs that are available.
Yeah, of course. I mean, so in a British diet, cooking for ourselves instead of buying processed foods, are there any particular herbs that you would recommend for sort of maintaining general sort of good health?
Oh yeah, all culinary herbs and spices. Yes, they are all medicinal. And obviously there's a difference between if you take it as food, so it's usually small doses, so it works as a tonic. It just helps your body to sort of, nudge your physiology. But if you take in larger doses, obviously that becomes then medicine. Mm. And it's the same with toxins. If you have little bit exposure, it's generally okay, but prolonged exposure, not great.
Yeah, definitely.
So it's the same with herbs. Use them every day with all meals, even breakfast. Add in cinnamon if you like sweet breakfast, or if you have your eggs, put some chili powder, add some turmeric. It just really adds up. And I always say to myself, but also to my patients, like, right, have I eaten from my genes today? And if I think that, I generally in the morning, I try to have my breakfast that I am supporting my genes.
How wonderful.
And lunch, generally, yeah, I'm supporting my genes. Have I had enough, vegetables and fruits and herbs and spices? And even if the evening meal sort of like, goes a little bit, maybe it's not the most healthy, I make sure that I have supported my genes. And it's a little sort of mindset thing that I'm saying to patients, and try to, because herbs and spices are there. When you think about like Italian sausages, for example, they add fennel there. They add sage. So fennel, fantastic for people with a lot of flatulence. Sage is a fantastic herb, for memory, but for culinary herbs, it's brilliant for help to digest fats. So it helps your gallbladder and fantastic. And we already talked about rosemary, fantastic herb, and it's also really protective for the liver as well, and it helps the phase 2 detox as well, and it even seems to be protecting against toxic polycarbons that when you barbecue meat, for example, the burnt bit, that is quite tasty, but it's not very good for you. So rosemary, marinating meat in rosemary and garlic and olive oil, that tradition comes from Mediterranean area, and it's there for flavor, but it's also really protective.
Which you wouldn't think. I mean, a lot of these things are rooted back hundreds, thousands of years, aren't they?
Yeah, absolutely. We have evolved with plants.
Yeah.
Yeah.
So we shouldn't in any way disregard. I mean, what you're talking about is so much deeper than eating your fruit and vegetables.
Yeah.
Even though that's a start, that's sort of like a surface level, but this is a lot more.
Well, you see, Professor Tim Spector, Zoe study, talks about eat 30 plants a day or a week. And herbs and spices all add up there because they contain these plant chemicals, these phytochemicals that are amazing. And those phytochemicals are plant secondary metabolites, which basically means those plants have created those chemicals to protect themselves against environmental factors.
Yeah.
And when we eat those chemicals, that protects us and our cells.
Beautiful.
Yeah.
And that's what it's all about, isn't it?
Yeah.
I mean, we have dentition to support us eating plants. I mean, yes, we have some dentition to support us eating protein, animal tissue as well. But the majority of our dentition is all about eating plants, isn't it?
Yeah, absolutely. Absolutely. And fiber. And, there's currently this carnivore craze. And I'm thinking, like, oh my gosh, their microbiome must be hurting so much.
Yeah, it's going to be shot, isn't it?
Yeah, and people are like, oh, but I feel much better. It's like, initially, probably because you've cut out all the crap.
Yeah.
But overall, it's not great. We need to have a lot of fiber, and, fiber is really important for all sorts of things. And when I talk to some of the patients who've got slightly elevated cholesterol, I mean, that's another topic that I can... Because, again, there's numbers and there's numbers.
There is, but please say a little, because there'll be a lot of people listening that have cholesterol issues or know somebody that does.
Okay. So the reference ranges again. So I think needs to be under 5 total cholesterol. And that to me as a standalone number means nothing, because we have these different particles and the ratio between LDL and let's say good cholesterol and bad cholesterol, neither of them are good or bad, but
that's the way they've been labelled,
yes,
isn't it?
Yeah, has to be in balance. But then we also need to look at other things like oxidized cholesterol and ApoB, and there's different. We need to look at things like homocysteine, which is really big marker of cardiovascular disease. So if somebody's got what NHS thinks that is slightly elevated cholesterol, when we look at the trends, if that person has always had that number, let's say 5.8, whole life, I don't know, 50, 60, 80 years, I don't think that is a massive problem, because they've always had it.
Yeah.
And if the ratio is okay, is fine, then those numbers mean nothing. And if the homocysteine is in a completely optimal range, again, I don't see it being a massive problem. But homocysteine, again, it comes down to some of the SNPs, some of the typos. So you need your B vitamins, especially B12 and folate and all that as well. So, but coming back to fiber, so people are always a little bit confused when I say that let's add more plants, let's add more fiber. It's like, why? We're talking about cardiovascular health. It's like, well, we're talking about health, not just cardiovascular health. Yeah. And cholesterol really helps to, it can then bind to fiber, and then we can get it out the body. So
if we've got too much floating about, we all know, everybody's seen those pictures, haven't they, that get put out there, often on cigarette packets, of all this yellow fat clogging up arteries and, you know, capillaries and all the rest of it. Yeah. So it's something that the general public will have some conceptual grasp of what needs to be got rid of. Yeah.
Yeah. But we need cholesterol. We need cholesterol to make sex hormones.
Absolutely, yeah. We can't do without it,
can we? Our brain.
Yeah.
You know, and often people are put on statins. I mean, that might be a little bit controversial, but they put on statins too early before. They never talk about, you know, exercise and food and fiber. And it's like, right, take statins. And then they don't talk about that. Oh, that's going to deplete your CoQ10. So you might need to take that because it's fat soluble and it's sort of, but you know, it's a minefield but patients don't know what they don't know. But I mean, overall in life, we don't know what we don't know.
No, that's a general rule, isn't it?
Yeah.
But these things don't tend to be taught, do they? We're very much still in a culture of something goes wrong and you go to your GP.
Yeah.
And they potentially refer you into specialist services somewhere. What you're offering should be a first step. The GP should say, right, well, I'm going to refer you to Kaidi because you need a workup here of, you know, the more intimate details of what's going on with inside you that I haven't got the time in my 10-minute appointment to do anything about, but is important.
Well, I do get some GP referrals sometimes, which is quite lovely. But it's because, you know, the GPs, they follow nice guidelines. So they have to like, right, these are the numbers. Now I need to give you statins. So these are the numbers. Now I need to give you metformin, you know. But the medicine has, I don't know if you noticed that in the last few years, moved very much into patient-led practice.
Oh, yes.
That patients are now that, right, I don't want statins. And then the GPs can't force it. And, you know, that's when the referrals come. And I mean, overall, I think we need to think about medicine as practice. It is a practice, you know, general practice.
Yes.
Medical practice.
Clues in the name, isn't it?
Yeah. And patient, you know. It's sometimes it takes patience to get the results.
Yeah, exactly. And something that you're doing is much more looking at the root cause.
Yeah.
You're looking at the numbers and where they are, but you've got time to put the deeper thought into it.
Yeah.
And think, well, that's because this has happened in their life, this course of antibiotics, this trauma, this whatever it might be, which GPs with the best will in the world haven't got the time to be able to do that. And I think this patient-led thing is really good in some ways, that patients can say, well, absolutely no, I don't, I want to look for something else.
Yeah.
But sometimes it can make interactions with them exceptionally challenging.
Yeah. Yeah.
You know, on a hospital-based. I mean, I respect everybody's opinion. Anybody can say whatever. But there's also got to be an element of, well, you know, I've spent X number of years training in this, just as you spent X number of years training in what you do. So why are you consulting me if you're not going to give me any credence?
Yeah. Yeah.
So I think it's all about being humans and being decent people and having respect, isn't it?
Absolutely. Absolutely.
So
Yeah.
do you have an ideal client, somebody who would be a perfect person for you, or do you have a typical type of client that comes to you?
It's changed over the years, and I found now I do these gene tests or the nutrigenomic tests. That can be done for anyone, and I think really, it's good to get them done when you're fairly young. Not that you're probably going to do lots about nutrition, but at least, you know, it's there, you know, the information that, you know, eat more broccoli. But my clients, so it depends. The gene test is pretty much anyone, because it's online based as well, and, you know, it doesn't, you know, there's no demographics really, but it tends to be more women over 40. But in my private practice lately, it seems that there seems to be more older gentlemen. So, but obviously we're trained at everything. And, you know, as I said, it's a practice. Medicine is a practice. And sometimes when we don't know something, I generally don't BS and say, you know, if I don't know something, it's like, right, I need to do a bit of research, and you know, and I think patients respect it as well. Yeah,
especially if it's outside of the so-called free NHS.
Yeah, and sometimes some symptoms or something can be quite rare.
Yeah, for sure. Yeah, rare things do crop up, don't they?
Yeah.
Like in medicine, you say common things are common, and that might sound like a really daft thing to say, but it can sometimes help your thought processes, can't it?
Yeah. Well, I really enjoy working with people and sort of like, you know, when you build a rapport with patients as well, it is a lot about education as well. And, you know, explaining what's happening in their bodies in the, you know, sometimes funny ways, and also talking about herbs and supplements. And my practice has changed quite a lot since I do the gene tests as well, because I really, really, really lead with nutrition now, because I find it that has to be the base. So, you know, if somebody's got anxiety, they're most likely really low on B vitamins and magnesium, and I can give you some herbs and they will help, but we really need to balance those nutritional imbalances there. And and, you know, if there's any typos on the genes as well, then we really need to, you know, have maybe much higher magnesium or maybe much higher vitamin D levels, or and then the herbs as well. And
that's all done really easily. Do you send them out like a test kit and they do their own swabs and easy peasy then?
Yeah. Oh, this science is really exciting. It really is. It's just...
you could get lost in it, couldn't you? I see many potential rabbit holes there.
Exactly. And then, you know, it's pretty much every week I learn something new. And that is the nature of medicine.
Yes.
It's like, you know, it can be overwhelming for patients because there's so much information, and it can overwhelming for us as well as practitioners. But then you just need to think about, like, right, I'm going to focus on, I don't know, this week I'm learning more about hormones. What's new there? Not the function, but, you know, the treatments.
Yeah.
And also, sometimes we learn from herbs, from plants.
Yeah.
Which is quite lovely as well.
Absolutely. That feels delicate, but it's powerful. I have one final question I want to ask you, something that's quite topical at the moment. All these synthetic GLP-1 analogues for weight loss. I mean, GLP-1 is a natural hormone that we have in our bodies, isn't it?
Yeah. Well, let's come back to the liver. So, herbalists we are a little bit obsessed with the liver. And I always said to my students as well, that in the final clinical exam, if you're really nervous and you haven't got a clue, like you've forgotten all the plant names and everything and what should go together, you really can't go wrong if you prescribe some liver herbs. And in herbal medicine, we have something called the bitters. And you take them before food, usually about half an hour. And it really preps your digestion. And they work in a quite amphoteric way that if they need to, they raise your appetite, but they also suppress your appetite. But it basically really prepares your system for digestion.
Sounds sensible.
Yeah. But also when we think about, again, coming to like Mediterranean diet, they would have their salads, bitter salads, before all the other food. Again, it's the same effect. It prepares your digestion. It prepares your liver to create more bile, and then the bile goes into the gallbladder and it gets released. So it's all prepping for the meal, and it's the bitter foods and bitters. Yeah.
Angostura bitters dropped into my head then for something in the pub. When I used to work in the pubs, that was something we used to have on the back shelf.
Yeah. Well,
an aperitif.
Gin and tonic.
There's a theme here.
Do you think so? All those botanicals, and it's also bitter.
Yeah.
Yeah. And when we think about alcoholic drinks as well, obviously alcohol is a neurotoxin. Nothing of it is healthy. But we also know from blue zones that, little bit of alcohol amongst friends, actually the damage, that the potential damage overweighs everything else. And, there's the most centenarians in those areas, so they must be doing something right.
Yeah.
But, what they all do right is they eat fibre. They eat lots of plants in all those areas. They've got friends. They usually live in hilly areas, so the exercise is natural. They have friends. It's just everything together, isn't it?
Yeah, it is. It's the big picture, isn't it?
Yeah.
So these analogues that a load of people are taking now, they're just completely masking all the normal activity, aren't they?
Yeah.
In the liver and the gut as a whole, in the appetite centres, in the brain, everything.
And also people lose muscle. And muscle is very expensive for the body. It's very expensive. Because especially women over 40, but men as well, when you lose so much muscle quickly, especially as women, you're never going to get it back.
No, and your kidneys massively struggle, don't they?
Yeah.
Can put you into renal failure if you lose too much muscle quickly.
Exactly. And when you think about, we don't have the long-term studies. These drugs were approved, but I don't know. I think overall, when we think about weight management, there needs to be a lot of mindset, because I think weight is such a complex issue that it's not that people don't know what they should eat. I've actually noticed that with the gene test, people tend to think more because they're eating for their genes.
Yeah.
They're eating for their genes and for their jeans they're wearing.
Excellent. I like that.
But because there's so much psychology there, isn't it?
Yeah.
That is not just, because so often is people put on weight because it sort of feels, there's a psychological reason. It's a protection.
Yes.
We need to think about releasing those things together with different therapists.
Yeah.
Probably not talking therapists. They usually not very effective, but some like hypnotherapy can be really, and trauma release and EFT and even like fascia work, because fascia is another topic that is fascinating, that we hold so much in our connective tissue, and it surrounds everything.
Yes.
And even all the injuries we have ever had, any scars, they all affect our fascia. And when that gets released, often a lot of emotion gets released as well.
Of course.
And then when emotion gets released, weight gets released.
Yes, because we're not physically holding it anymore. It's wonderful, isn't it? The body's an amazing piece of kit.
Yeah. Well, because I see it with people with patients with constipation. We've done everything. They drink enough water. They eat the right kind of fibre. We've done everything. They've got the bitters. They've got everything. And then in the end, sometimes obviously it can be side effects of drugs as well. But let's say they're not on drugs and we've done everything. And then I literally have to ask, what shit are you holding on to?
Yeah, literally.
Why are you holding on to this shit? And then they laugh. And it's like, yeah. And then
get rid of it from up here, and then you'll be able to get rid of it elsewhere.
Yeah. Well, bitters usually help as well, but when it's emotional, and the diagnosis as well, like IBS, it's such a BS. It's not a diagnosis. It's just a set of symptoms. And more often than not, in herbal medicine, we actually work more on the nervous system to get that solved.
Yeah.
Than obviously the gut as well and everything else. But the nervous system seems to be, that needs a big support.
Because we're all interconnected beings, aren't we? Nothing within us works in isolation.
Exactly.
But you've got to start somewhere.
Yeah.
And why not with what Mother Nature provided?
Well, when you look at animals and what plants they eat, there's a herb that this sounds really funny now, that cats and dogs often eat, but I prescribe it to most patients. It's out this time of the year. It's called sticky willy. Well, the actual name is cleavers, but it's known as sticky willy. And if you want a bit of sticky willy juice in the morning, it really helps you flush out toxins. It works on your lymphatic system, and it tastes wonderful as well. So you put it, we'll probably need to put a link what it looks like, but it's the sticky sort of, it's also known as goosegrass. And you pick it, a good handful, chop it up, or wash it, chop it up, put it in cold water, leave it overnight, strain it. First thing in the morning, it is so refreshing. It tastes like cucumber. Oh. And it's so lovely. I mean, you'd be peeing the next hour or so.
Okay, so it's a really good diuretic.
It's good diuretic, it's good lymphatic. So, but it's such a great spring tonic. And again, is, choking with the patients and they remember.
Yeah, exactly.
They're like, oh, it's that sticky willy.
Yeah, exactly. And that's all it needs, isn't it? Just a few things like that to sit in somebody's mind.
Yeah.
Toxic sludge, sticky willy. I mean, come on, what more do you want? They're going to stick.
Exactly.
Oh, I love it.
But also you need to laugh with patients as well, because, then they relax and it's like, oh yeah, I do like this sticky willy, it's nice.
There you go. Yeah. Oh my goodness.
Well, cats and dogs love it.
Yes.
It's because they need it.
Yeah. Which is another vote against too much urbanisation, isn't it? Too much concrete, not good for us.
Well, exactly. I think overall, my number one prescription to everybody is spend more time in nature.
Wonderful. And that brings us right back to the beginning, which is where you grew up, isn't it?
Well, exactly.
Fabulous.
Exactly.
Fabulous. Well, I've really enjoyed this. This has been an incredible conversation.
Thank you. It's been wonderful.
So I've thoroughly enjoyed it. So I want you to make sure that you provide me with lots of links and pictures and ways that people can get in contact with you.
Yeah.
possibly a representation of toxic sludge and sticky willies. I mean, that's just got to be in there, hasn't it? So that people can go and get this wonderful sensation in the morning and feel better.
Yeah, absolutely. And it's safe. It's so safe.
Yeah.
So obviously, as I said earlier, some herbs you have to take under supervision.
Yes,
but
of
some
course.
of the other ones, they're just so safe. They're just there.
Wonderful.
And, yeah.
Thank you, my darling.
Well, thank you for inviting me.